Good morning or good afternoon, depending on where you are joining us from. My name is Toy Williams, and on behalf of the National Healthy Worksite Program and the CDC, we want to thank you for joining the fourth installment of our Worksite Health 101 webinar training series entitled Program Implementation. Before we begin, I would like to mention the slides for today are available on the National Healthy Worksite Program website, which I will share with you at the end. We are also offering 0.2 CEU credits and 1.5 CHES credits for those of you who are interested, which will be available for redemption immediately following the webinar. I will be sharing that website at the end as well. This webinar will be recorded and shared through the program website later. You will be notified by email once it is posted. In registering for this webinar, you have also been added to our mailing list. You may send a request to be removed from the program email if you no longer wish to receive updates. We are extremely excited to welcome our featured speakers today, Jessica Davies, Bob Hardison, and Kirsty Settas-Jones. Jessica Davies is the Wellness Coordinator with Panhandle Health District. Her nearly 10 years of experience at the Health District has afforded her many opportunities to become adept in the development, implementation, and evaluation of preventive, evidence-based programming at all socio-ecological levels. Much of Jessica's work has been collaboratively strategizing on population-based approaches towards the prevention of cardiovascular disease through the primary prevention areas of increasing physical activity, improving nutrition, and decreasing environmental tobacco smoke. She is a certified Worksite Wellness Coordinator and Manager, providing ongoing technical assistance to worksites throughout an evidence-based process, reinforcing environmental and policy strategies. Jessica helped bring the Panhandle Worksite Wellness Council to fruition, which provides significant benefit and ongoing resources to organizations through the region. Bob Hardison has been Director of Human Resources for over 20 years. He designed and implemented WAVE, the Wellness Initiative at Henderson Behavioral Health Center in Florida. He believes workplace wellness is a core business strategy for the organization that helps take care of the most valuable company asset, the employee. WAVE focuses on health issues and concerns identified through health assessments and biometric screening. They hold a number of initiatives throughout the year, such as various health education workshops, the Biggest Winner Contest, Healthy Motivator Tip of the Week, Walktoberfest, and various communications. Kirsty Settas-Jones serves as Director of Corporate Health Management and Wellness Services for Sightland, a Marsh & McLennan Agency LLC company. Kirsty's background includes over 15 years of corporate health and wellness consulting, most of them with a consulting company she established in 1996, which focused on organizations with over 1,000 employees in multiple locations. Kirsty also has a background in financial business consulting, all of them working as an independent contractor for various organizations. Her experience covers all aspects of business operations, but was highly concentrated in the health and wellness arena. Kirsty holds an accounting degree from Chancellor University in Cleveland, Ohio, and an MBA from the University of Phoenix. Henderson Behavioral Health was the winner of the South Florida Worksite Wellness Award for mid-sized employers in 2010, and Marsh & McLennan Agency is their insurance broker who helped implement the WAVE program. Everyone should have received a copy of our featured speakers' bios along with instructions on receiving continuing education credits. Today, Jessica will be covering background and strategies. Bob and Kirsty will be covering strategies and budgets, and they will all be doing a brief summary at the end. Pending time, we will have our speakers answer a few questions from the audience. If your questions are not answered live, you may send them in to nationalhealthywork@cdc.gov. Again, that's nationalhealthywork@cdc.gov, and you will receive a response directly. I will share the addresses again at the end of the presentation. This is the fourth of 5 national training webinars, which will cover implementation only. As you can see from our diagram, this is part of the fourth module of the National Healthy Work Program, Worksite Health 101 training, which we have split into 2 sessions for the purposes of these webinars. We combined making the business case along with leadership and culture and delivered those in the first training in June. Data collection was delivered in the second training in September, and planning was delivered in January. While it is not a requirement to have attended those webinars, it is a benefit to help you better understand the information. Recordings of the previous webinars are posted on the National Healthy Worksite Program website, along with CEU and CHES credits for some of them. The last training webinar will be on program evaluation on July 15th. These are our learning objectives, which are program strategies and interventions, different types of worksite health interventions, along with real take-home examples. This is the CDC Workplace Health Model. Today's presentation will be covering the section in red. Program planning and implementation are the second step toward implementing a comprehensive worksite health program. These include implementation of programs such as educational policies, policies such as organizational rules, health benefits such as insurance, environmental support such as access for everyone who wants to participate. Based on your assessment, you want to plan and implement a program that best fits your company's and your employees' needs and links them with help to your business plan and objectives. Workplace governance, which define and emphasize that organizational support is critical, along with contextual factors like company size and sector, are common to all stages and are foundational. As I mentioned before, we had a planning webinar in January. I'm going to give you a brief overview to help you better understand the information presented today. So once you have completed an assessment to determine what your need is, you should begin the planning process. This is an example of a strategic plan. It gives you an overall view of the levels of your plan over a period of time. This one example is of a plan to year 3. You always want to consider where you will be in the future. Your plan overview should have your strategic focus, which is who are you targeting. Typically, the first year is geared to be employee only. You can add family members in subsequent years. Your budget will drive what services you offer, but you don't need a massive budget to have a successful initiative. Your services can include things like policy changes, educational programs, and environmental support. Champions and a wellness committee should be at the heart of your services to organize the initiative and drive participation. If you plan to have incentives, they should be well thought out and planned for. They should also be tied to specific goals, like completing a health assessment. Marketing and communications are essential to gain interest in your program. The type of marketing you plan to do, like creating a brand and a logo, and how you plan to communicate it, like incorporating the program, goals, and requirements in the new hire packet, must be considered. What metrics do you plan to measure for your program? You need to plan to have baseline measurements that can be tracked at least annually for progress. The health assessment and biometric screening serve dual purposes because they allow the employee to know what their issues are, if there are any, and they also allow you to have a measurement. You may also consider collecting feedback for the participants about satisfaction to make adjustments along the way as needed. You should also have an objective plan that lists specifics for each objective. This spells out the who, the what, the when, and the how for each objective. For example, if your objective is to have at least 90% of employees with at least one cardiac risk factor will increase their knowledge of preventing cardiovascular disease by 2-13, okay? You need to know when it's going to be done, what you're going to do that, how it's going to be done, who's going to be in charge of it, and what will you be evaluating. So as was listed here, the date that you wanted to achieve it was done was already listed in your objective. So 2-13, that was your date. How are you going to do it? In this case, they chose to do a Heart Healthy campaign during Heart Month. So that's their what. For the process of how they're going to do it, were they going to hire someone, an outside vendor, or were they going to get someone within the company to do it? In this case, they decided to do a healthy cooking demonstration, health education activity. If you're talking, can you please put your phone on mute? Thank you. For all shifts on the meal break. And then the responsible parties. You need to have someone who is going to be in charge of collecting that information. So in this case, Jane Doe is going to identify the American Heart Association to help come on site and do that cooking demonstration. And then for their evaluation, how are they going to know what if the participants' knowledge increased? Well, in this case, they decided to do a pre- and post-test knowledge survey, and along with a satisfaction survey to get feedback from their participants to make sure that if there's anything they need to change, they can go back and make those changes. Remember that making changes takes time. So set reasonable expectations to achieve your goals. Your expectations should be based on how difficult the behavior is to change, what financial resources are available for your initiative, what policies or environmental changes need to take place to support the behavior change, and how many people do you need to drive the program. These are just a few tips to consider for planning. Again, if you missed the planning webinar, you can view it online. Now I'm going to turn our presentation over to Jessica Davies.
Thank you, Joy. And welcome everybody for being on the call. I feel like the implementation part is really the fun part from all that planning and assessment phases. So some considerations when you are at the point of implementation. Obviously you want your efforts to be driven by that data collection and assessment phases. So what are those top health risk areas? What are those highest healthcare utilization areas? Or maybe you even completed the recent Worksite health scorecard and you're interested in implementing some of those findings. So you want the data collection and assessment to be driving that. You also want to address the most common or costly health risk or lifestyle factor. So maybe you have a high percentage of smokers or a high percentage of employees that are overweight or obese. Just one caveat with that is just to make sure that employees don't feel threatened or that you come in with a heavy-handed approach with that. You really want to have a supportive tone. I've seen that happen with aggressive tobacco policies, that people feel threatened. They came in right away and implemented a pretty aggressive tobacco policy. You want it to be sort of ease into it, and if you can't address that most common or costly health factor at that point, you can slowly get to that point. So along with that, areas for consideration, employee interest. So what are they interested in? What do they want to see? What does your budget look like? And do you have any time constraints for implementation as well? And then what are management expectations for the overall program? You want to know that. You want to make sure that you're balancing those expectations properly. And then I would really, really encourage everybody to spend time reviewing those strategies that are effective and evidence-based. We're going to give you guys some ideas for that in the next few slides, but really take your time with that. They're tried and true. Don't discount the values of those strategies. And there's a lot of great resources for that. We'll talk about that in later slides, but some are like the CDC's Community Guide, Partners in Prevention, National Business Group on Health, and then different state toolkits have a lot of those resources as well and ideas. So like I said, we'll get to that in some later slides. On to the next slide as far as program strategies and interventions. There are 4 strategic areas for intervention. So we have individual, interpersonal, environmental, and organizational. So at that individual level, what that does is it affects elements of an employee's lifestyle, and that might be an example of like health behaviors, health risk factors, or their current health status. How you could do that is through things like health coaching, biometric screenings, and what you're wanting to increase that individual's capability of preventing injury or illness, increase those knowledge, attitudes, behaviors, or skills at that individual level. When it gets to interpersonal, you're affecting elements of an employee's social network, which include it might be like a relationship with their managers, coworkers, family members, anybody that provides support or mentoring or in a mentoring or role model role. An example could be including family members in health screening or programming that you're doing on the Worksite, incentive campaigns. You really want to strengthen those social supports an employee has to continue that and maintain that positive behavior change. At the organizational level, that affects elements of a workplace structure, practices, and policies. So these things are like your health benefits, health promotion programs, work organization, and leadership and management support. And then at that environmental level, this affects the elements of a physical workplace. So when you hear the term make the healthy choice the easy choice, that's really what we're talking about, is whatever we can do to make that environment conducive for health and for employees to easily make that behavior change. Examples would be like stairwells, outdoor walkability, vending machine access, cafeteria options, even access to clean water sources. So like I said, it's however conducive that overall environment is to support those lifestyle behaviors. And one thing I will say about this, at the environmental and organizational level, really your impact is much greater and your cost at times is lower. So you really honing in on those ones. You want to make sure you're in all levels, but I will reinforce that those two, again, have a greater impact and the cost is lower as far as implementation. But then on those individual and interpersonal levels, your intensity as far as implementation can be higher at times. The cost can be a little bit higher and your impact is lower. So that's why we want to have a full balance of all of the areas. I know people get pretty excited and they want to focus in on different programs and things, and that's wonderful. But just make sure we're hitting all those areas. We'll give you some ideas how to do that. As far as for the next slide, as far as types of worksite health interventions, there are 4 main types. They encompass programs, policies, environmental supports, and then health plan design. I'm going to talk specifically about policies and environments, and then Bob and Kirsty are going to talk about programs and then health benefit design. So as far as with programs, these are really the opportunities available to employees to begin, change, or maintain a health behavior, like we talked about with individual coaching or health classes. That's at that programming level. For policies, these can be formal or informal statements that are designed to protect or promote employee health. So a couple examples of that would be like tobacco-free campus policies, healthy meeting guidelines. So anything that's served at a company-sponsored function has certain criteria that you're following for food. On environmental supports, those are really those physical factors at or nearby the worksite that help protect and enhance employee health. Like we talked about stairwells, walking paths, anything, whatever makes that healthy choice the easy choice. And then from the integrated health benefits strategy, these are the health plan design to really impact the key risks and cost drivers by influencing behavior change. So things could be preventive screenings that are included health benefits, nutritional counseling, tobacco cessation support, all of those things that will help them from that side of it as well. If we move to the next slide, the multiple strategies are the most effective. So like I talked about with make sure you're hitting all of those areas. Comprehensive worksite health programs, you really want them to strive to use multiple interventions. An example would be combining policy and health benefit strategy for a single health issue, because combinations are more effective than any one intervention alone. Just an example of that, we have a great organization in our area that did just a wonderful job with their tobacco cessation program, which is part of their comprehensive wellness program. So their goal was really to transition their campus to tobacco-free in an effort to overall reduce smoking and tobacco use among employees. So at the programming level, they train staff to implement an evidence-based tobacco cessation curriculum, and they do provide that ongoing as well, so sessions are happening all the time. At their health plan design, they provide nicotine replacement products, the medical evaluation for prescriptions like Wellbutrin or Chantix, and then they continue to provide these supports along as they transition to their tobacco-free campus. And then once they transition to that, then those things are still happening as well. So, and then at their new employee orientation, they specifically hone in on the resources they have for tobacco cessation when they're talking to their new employees that are coming on, in addition to all their other wellness program things as well. So using that multiple level approach resulted in their latest survey data showing about 9% of their employees use some form of tobacco. And this is pretty significantly lower than state and national data, which is about 20%. So you can see those multiple levels are so important. And then using interventions that address multiple health issues as well are also more effective than addressing each issue separately. In our area right now, we have we're implementing the National Diabetes Prevention Program actually at Worksite with employers that are in our council. So although it is targeted at reducing prediabetes, those core areas of that program are to improve nutrition, increase physical activity with a goal of about 150 minutes per week. And then through those sessions, the goal is to lose about 5 to 7% of body weight. So you can see that through the nutrition supports, physical activity supports, and then the reduction of overall body weight, those core areas not only impact diabetes rates or prediabetes, but it also impacts heart disease, obesity, and then some forms of cancer as well. As far as the environmental support side of it, the physical environment can be a barrier or it can be a great help to individuals attempting to make a behavior change or maintain a behavior. So things like vending machine access or conveniently located snacks that are you can eat during the workday, or on the other side of that, if you have an environment that has convenient, healthy food options that can support increasing fruit and veggie intake and cut down on snack food consumption. So that's just the difference as far as how we can help our employees throughout the day, instead of just preaching to them, hey, let's do these nutrition programs or get your 5 a day, those types of things. You're really helping to make that happen throughout the day, providing that support for them. So some examples with that, like we talked about tobacco-free workplace or campus-wide policies, showers and lockers that would support physical activity, even parking for bicycles. You don't think about it, but a bike rack, that seems pretty simple, but it can be a great support for people to get to bike to work or for active transportation. A stress management room or relaxation room, ergonomically sound workstations. A big thing that we've seen out here right now, walking workstations or standing desks, so employees are not sitting all day. Those can be very simple modifications to current work environments to help people be up throughout the day instead of just sitting. Healthy vending and cafeteria options. and really taking it to another level of displaying those healthy options as the main choice, and then maybe either not having the unhealthy options or placing them in a less visible location, or a company kitchen with utensils. That can help employees throughout the day as well. A lactation room for nursing mothers, and taking it to another level of not just the locked room, but also, do you have refrigeration for mothers to express milk? Do you have a clean water source for them to clean utensils? What about our supervisors supportive of that as well? And then some have even gone to the level of providing like a hospital grade pump, and then mothers only have to purchase the hookups. So those are just whatever we can do to provide those ongoing supports for those healthy behaviors. We have a great an organization here in our area that actually created a safe walking path. They're a manufacturer. They have a safe walking path throughout their facility, and it goes in. There's different variations of that walking path. So you can go inside and outside their facility, but that helps throughout the day. So employees are not just at their workstation, but that they can go for a walk. You can take a walking meeting at that. That's a wonderful support. And some work sites have even gone to the level of like working with vendors to provide free or low-cost fruits and veggies, fresh fruits and veggies, and low-fat dairy products in their company refrigerator. We have a great example of a work site that we've seen like employee gardens, or we actually had a work site that went to the level. They worked with a community-supported agriculture or CSA vendor in their community to purchase fresh fruit and veggie boxes on a twice-a-month basis. The vendor would bring them on site for employees to take home, and really the best part was that the employer worked it out. So all the employees that opted into it, they would just automatically payroll deduct it. So twice a month they get a fresh fruit and veggie box. It was payroll deducted. All the kinks were worked out. They'd get to go home with that. So great environmental support. On the policy and benefit examples, so policies are formal or informal rules that guide behavior. So much like environmental changes, policies can have a major impact on individuals attempting to make a behavior change, or again, to maintain that healthy behavior. And then as far as the benefit side, you want to structure those benefits to help to support those healthy behaviors and reduce and risk reduction. And that could be through benefits like tobacco cessation counseling, nicotine replacement therapy, nutrition counseling, like we talked before. And then for existing benefits, an excellent strategy may be to focus on increasing utilization of benefits that are already being paid for. And a couple of examples, like we talked about with the tobacco-free campus, and then I thought this was a great idea that an employer used in our area. They have a wonderful EAP program in place. However, they felt like their utilization was pretty low. So they actually took it to another level, and they asked a trained professional to come on site once a month. And they facilitate almost like a debriefing session for the group. Kind of like a facilitated venting session, but it's really by a trained professional. So you can see that's not necessarily a direct policy or benefit, but it does provide for that ongoing supportive culture. And then employees don't have to, if they want to take it to the level that they feel like they need to use their EAP program more intensively, they still have that support, but they know that they have this as well monthly. Flexible work schedules, they're not only great for physical activity, but they've also been cited as helping to relieve employee stress. I'm sure you guys, many have seen the research. If employees are in a high demand, low control work environment, it really can be a perfect combination for stress. And of course, stress exacerbates the problems of chronic disease. And I realize that not all work environments are conducive to flexible work scheduling, but if you can, it is a wonderful benefit. And I will say for our internal program, even in our health district, work flexibility continues to be cited as the highest items on our job satisfaction surveys. Healthy meeting guidelines or policies of what food can be served at company meetings or gatherings. Very easy, wonderful support. I can tell you, I had went to a work site at one time. They had done health screenings, and then we were given a presentation on nutrition. And what they were eating after their health screenings was pretty shocking. I think the donuts, they're probably the largest donuts I'd ever seen, and the session I was given was actually on nutrition, and so it was kind of counterproductive as far as what the message we were trying to send to them as far as nutrition. But then they were, provided these gigantic donuts after that. So it's one of those things that we just say, if you're going to have anything wellness related that you want going on, it's got to have, any company sponsor function's got to have healthy food there. And then even like allowing employees to sort of be on the clock during health promotion initiatives or chronic disease prevention programs like health screenings, wellness presentations. That's another great supportive policy in addition to the ones that were mentioned on here. And then I will now turn it over to Bob and Kirsty.
Thank you, Jessica, for that comprehensive overview of strategies and intervention. And I'd also like to thank the National Healthy Worksite Program and the CDC for inviting Bob and I to present today in your fourth installment of the Worksite Health 101 webinar training series. So to move on to your health benefit design changes, we've helped not only Henderson Behavioral Health, but many of our other clients design their benefit package to really support their worksite health promotion program. One example of that is tobacco cessation medication, making sure that if tobacco cessation or smoking is one of your risk factors, making sure that your plan supports adding Chantix as a benefit that can be paid by the plan to ensure that those people who are interested in quitting smoking, if they want to use that particular nicotine replacement, that they have that available. Or even implementing lower copays for disease management drugs such as cholesterol or blood pressure. Adding in low or no-cost preventive services, your mammograms and things such as that. The big piece that we see a lot of clients moving to now is consumer-driven health plans to engage employees in responsible health choices, high-deductible health plans. The key to making that successful is to make sure that your employees know how to use it. Some employees get a little scared at, oh my gosh, I have a $3,000 deductible I have to meet now, and they don't know how to use that. And then funding maybe health savings accounts to help offset some of the costs that the employees have to cover on that high deductible health plan. Bob, is there anything that you'd like to add?
Mainly, and from my perspective, when interacting with the employees on a daily basis, it's the educating of the employees, the driving them towards consumerism, where they know, I can go to one store and my prescription is going to be $4, or I can go somewhere else and it's going to be $12. Also, we have with our plan mail order prescription, where the employees can, by mail order, put in make a double copay and get a 3-month prescription, so therefore saving them more money. And they're really interested in anything that we can do that will assist them in reducing their health care costs.
I think that's a great point, Bob. We like to use the analogy, when you are looking for a new car, what do? What's the first thing you do? You go out on the internet, you know which dealer is offering the best price, you know what color you want, you know what bells and whistles you want. We're not that detailed when we make healthcare choices. We just depend on our doctor to write a script or to say, go down the street to get your MRI, when you can do your homework on the internet and find that, brick and mortar building A might be different, might be a lot less cost-wise than brick and mortar building B to get your MRI. So we just like to make sure that we educate the employees on how to use the plan and be better consumers.
And during our last open enrollment for our health insurance, we had the insurance company that we had selected bring out a laptop and ask the employees, what procedure do you want to have done? What's your zip code? And they logged in and showed them how, once they had set up their own homepage with the insurance company, that they could go in, they checked the MRI and one zip code, and the range was from the basic copay of $150, but then what the insurance company would be paying all the way up to like $1,200. So the more that we can educate the employees and have them take charge of their own initiatives, the better things are.
So moving on to policy and benefit options. You want to make sure that you link your worksite wellness health programs to your benefit design. The biggest piece that we're seeing today is premium incentives and charging employees or offering an incentive to employees that choose to participate in your wellness program and meet the requirements that you've set. Currently, you're allowed to charge up to 20% of the full cost of the employee health insurance as the premium differential. I don't see many companies actually going to that full 20%, but knowing that you can really does go a long way, especially when the employees know that the government is backing that. It is in 2014 going to move to a 30% cost. And then there is a 50% smoker surcharge that can be implemented in 2014. I have some clients also that offer a richer plan for those that are qualified participants who participate in the wellness program. And then they have a not-so-rich plan for those that decide they don't want to participate. Studies have shown that incentives ranging anywhere from $600 to $1,200 per year really does incent your employees to participate in your programming. Incentives can also help offset your programming costs. So in actuality, your non-qualified or those that decide they don't want to participate end up paying more, and that funds your wellness program. So you have to be very strategic in how you plan out your incentives. Also keep in mind, are you going to start off with a participation-based incentive program and then move to an outcomes-based? Most companies, such as Henderson, are still in the participation phase and will eventually move into an outcomes-based program. I think it just depends mostly on the culture, how aggressive you want to be with your incentive program. And I know Bob has some things to add to that.
Yeah, the wellness program at Henderson is called the WAVE Team, which was named by an employee. In its inception, we had a contest with the winner getting a day off. So it's not something that you have to spend a lot of money on, and about 50 employees sent in suggestions, and that's the one that was selected. But we have, the first year we offered health fairs. We're in our 6th year now with the implementation of our wellness team, and we selected a person from every site, every major site that we have. There are about 15 in Broward County. So we have one representative from each of those sites, and they disseminate the information at the staff meetings that they have at their offices, and they attend a monthly meeting where the entire WAVE team, Zeitland, sometimes our insurer, is also there, where we come together. The first year was just the health fair. The next year we had the health fair and the biometric screening. The third year, the health fair and the biometric screening had to be completed, and you had to show that you had done those two things, which the health risk assessment is an online computer, personal, private information that just the employee gets, and at the end of it, it would show a receipt that they had completed it. That's all we required, and that they either attend the health fair to get a free biometric screening there, or submit a note from their doctor on a form that we had, very generic, just that they had had their blood pressure and blood work done. And for completing those two things, we created a healthy motivator rate for the employees that saved them $20 per payday. At that time, our pay was twice a month, so initially it saved them $480. We've gone to a biweekly program now, so the employees can save $20 a payday for 26 paydays. So now they can actually save $520 on their health insurance premiums for doing the requirements of the healthy motivator rate, which this year we now have included, because we try to step it up a little bit each year. This year we had implemented a points system. So if you got the biometric screening or the physical from your doctor, you got 25 points. If you did the health risk assessment, you got 10 points. To get the healthy motivator rate, you need 50 points. So they had to do something to get the additional 15 points that were required. 5 points is just for filling out a form attesting that you don't smoke, that you're smoke-free. So then you have 10 points left, and we have events every month, seminars, webinars, lunch and learns, walking contests, weight loss contests, all kinds of things, and all of those have points attached to them. So we've tried to continue to trend upwards with the healthy motivator rate and the things that our employees are required to do to get that rate. But with the turnover percentage, there are people that have worked here 6 years that have never known anything except the wellness initiative here at Henderson. So, over time, the culture changes. It was in the beginning seen as, why do we have to do this? But then when you make it fun and when you make it fun and get the morale of the employees involved, then it's a lot more productive. And the main focus, if you're going to be implementing a plan, that I would stress is you must have buy-in from the top. We have the CEO that went to every site that said, this is what we're going to do, and we're going to do it because we care about you. You take care of all these people that are ill in the community. We want to see that you take time to take care of yourself.
That's a great overview of the Henderson Behavioral Health Program. Just to give you kind of the other side, where Henderson is still in their participation-based phase, Sightland, Marsh, and McLennan is into the outcomes-based phase. We've done everything that Henderson has done, and we were a little bit more aggressive in upping the ante, if you will, year over year. Here now in 2012, we added spouses and dependents over 18 to our wellness program. So we have a full venipuncture. Ours is not a finger stick as a lot of companies are today to save costs. We have a full venipuncture that spits out a 30-page report, and I know I myself personally take that to my doctor every year, and she does not have to perform half of the tests that you would normally have to perform at your preventive screening. So that really does help our employees. Plus, being on the high deductible health plan, we're saving on costs. Another thing too that we implemented is you have to score a certain score every year or show a 5-point improvement from the previous year in order to qualify. So it's not just come and participate. We want to know you actually made some sort of health improvement over the year to be a healthier person. Our incentives range are a lot more than $600 a year, I'll tell you that. And you have to keep in mind with our grid and having 3 different plans and having, sometimes 3 or more people that are going to have to qualify for those incentives, you can only imagine what our payroll grid from HR to our vendor must look like. But once you implement it one time, it's easy from that point forward. So Bob made a great segue into program interventions and some of the types of examples of interventions that are implemented at the worksite. Besides your screenings and your assessments that give you what your employees need, doing surveys, all employee surveys, give you what your employees want. Classes and seminars can range on anything, on fitness, nutrition, stress management. Since obesity and overweight is such a prevalent risk factor across the United States right now, weight management programs are awesome to implement. You can have some sort of counseling and coaching and education for the employees. Having physical activity classes on site is very convenient for employees. It doesn't give them an excuse to say, oh, I'm on my way home, I'm not going to go to the gym today. So doing it right at your work site where there really is no excuse goes a long way. Any type of tobacco cessation, whether it be through your plan or through your consultant, such as Henderson has with Sightland, Marsh, and McLennan. The quit line, most states have a quit line that is free of charge and that offer low to no cost nicotine replacement if needed. Any sort of signage at Henderson and even at Sightland, Marsh, and McLennan, we always use our SWAT logo. Henderson always uses their WAVE logo when communicating any types of programs, whether it's via email and flyers, posters around the campus. and any other resources that you can provide through a portal. We've now implemented an online wellness portal for all of our clients, Henderson included, where you can go out and find different articles and information that can help you maintain healthy lifestyle. Bob, anything you'd like to add?
We had developed a WAVE bulletin board for each site. It was decorated. It was a normal cork board that items were printed up and tacked around on it, so that it was unique for nothing but the WAVE team. Postings went on that board, and they were all put in common areas. It wasn't stuck in the place where all the labor law posters are, which is the type of thing that you usually see that people don't really pay a lot of attention to. But the employees that are on the WAVE team get the emails, and the branch administrators get the emails and then post whatever events are going to be coming up on that bulletin board so that everyone knows where they can go to look and check and see what's going on, or they're in the kitchen making their lunch. The board is right there so that they can see it. That's been that and email blasts to all employees are what have really helped us to communicate to every employee at that level. And if they didn't really read the email at the time that it went out, then when they're in the kitchen preparing their meal or something and they spot it, it'll spark their interest, and our participation has increased a lot due to those things.
So in order to implement these interventions and even get a wellness program started, creating the culture is probably the first step after planning and your strategy. Henderson, Sightland, all of our clients introduce the wellness program to the employees at their orientation or when they're hired. So the first thing that happens when you sit down, you do get to see your benefit plan, but you also get somewhat of I guess you would call it a one-page overview that says, this is what the WAVE program is. This is what the Sightland MMA SWAT program is. This is what you can expect. And it really does get them right before they start working, and they know what to expect as we start rolling out all of these programs. We actually have a one-page overview that Henderson includes in their orientation package. That way the employees can take that home and review it at a later time. C-suite support, as Bob mentioned, Jessica mentioned, and I'm adamant about, it really does need to start at the C-suite level and then filter down to middle management. If the C-suite level supports what the wellness program, and then it gets down to middle management where they won't allow their employees to participate, then there is a communication gap there. So you do need to make sure that the middle management and supervisors support the wellness program as well. And you want to encourage them to engage in the programs that are being implemented. Even allowing the flex time, maybe there's a webinar going on and it's not taking place in lunch. Maybe let's find coverage for Bob if he wants to go to the webinar, but Jane does not. And I think it's very important to make sure that your C-suite and your middle management are very visible, and the employees see that they are participating. And I'm sure Bob can attest to this, that Dr. Ronick from Henderson Behavioral Health visits every health fair, actually does the screening, lets people take pictures of him getting his screening done, and it really goes a long way in showing the employees that he supports the initiative. And the last sentence is probably one of the best sentences, that your worksite health or wellness program does become the norm and not the exception in all aspects of business. It is a core organizational strategy.
After most events, we send out a survey to the employees. Did you participate? If you did not, why didn't you participate? They're anonymous. It doesn't track anyone's name or anything. It's aggregate data that we get. If people say, I didn't know about it, then we need to we need to do a better job of notifying them. In the case of employees that are looking for, some of them like the team concept for things like weight loss programs and walking contests and things like that. Some of them like the individual experience better. So we try to change up the different programs that we have, but we have now we also do, from the administrative office here, we have the ability to, when we have lunch and learn sessions, which have been very popular, to do a webinar so that anyone in the company can dial in and log in, just like you've done today, and have the same experience. When they log in, they're tracked and they get the points for being at the webinar that day. And we usually provide them a healthy lunch. They'll get, we have someone that's in charge of special events, and she'll get, subs that are cut into smaller portions, maybe a 100-calorie bag of chips, and then water, so bottled water for the employees. So that's been a big motivator. They come get a free lunch, they get some points, they get to listen and learn something, and then they make suggestions about things that they would like to attend and learn in the future, and we use those suggestions to trend the new programs that are going to be coming up.
So now you're probably saying to yourself, all this sounds great. All of the strategies that Jessica talked about and some of the programming that Bob and I have talked about. What if we don't have a budget? What do we do? So some studies and estimates have shown that a reasonable investment in workplace health wellness programs is at least $150 per employee per year. Sometimes you can get your carriers to help you with that. There are wellness funds that are out there. There could be wellness dollars that the carriers do put on the table to help offset some of those costs. Also, implementing the premium incentive can help offset those costs, as we talked about earlier. And make sure you prioritize your budget based on what you think is going to add the most value. Right off the top, you know that screenings and health assessments are going to give you the benchmark data that you need in order to roll out programs that address your risk factors. Coaching and counseling, sometimes you can get that through your carrier in the disease management program. Don't try and reinvent the wheel. Utilize those tools and resources that you have that are free or no cost to you. Free or low cost to you. Easy things to change, your environmental changes, as Jessica talked about earlier. Your healthy vending, your tobacco cessation policy at work. Things like that are easy to change that don't have an impact on your budget. And again, we just talked about the policies to decrease tobacco usage. Even something as simple as offering healthy food alternatives at breakfast, company breakfast or lunch is an easy thing to do. You're already spending the money. Just kind of segue some of those costs into healthier options. And I think, again, this last sentence on the slide, developing your budget based on your program. Don't design your program to fit the budget. That's just not going to work. And I know you got to keep in mind, Henderson Behavioral Health is a nonprofit agency, and they've been able to make their comprehensive wellness program really add value to the employee benefits at Henderson. I'm sure Bob can talk more about that.
Yeah, the first year, I would like to encourage people, don't be scared at the $150 number, because we had the health fair and several, not webinars at that time, but just lunch and learn sessions, and throughout the year, about a half a dozen of those, and the health fair to kick off our wellness program. And at the end of that year, we calculated we had spent $9 per employee. We had implemented our first year for 600 employees at an average of $9 per person. So it doesn't have to be expensive. You can start off and then grow into it more. We've just gotten our premiums to where our increase for our health insurance is the lowest that it's ever been, because our claims are way down. And we've had a lot of people through the health fairs and the screenings and things that have been caught with high blood pressure, diabetes, and a lot of other issues that, if they were left gone untreated, could have possibly impacted the health insurance costs that we have. You don't have to spend a lot of money. There are a lot of ideas that that Kirsty's brought to us that I would love to do, but we don't have the money to do them, so we kind of improvise. At the health fair, we have a free chair massage the employees love. We have the paraffin hand wax, where they put their hands in the wax and wrap them up and softens their hands. So they have those kind of things for the employee discount. There's a dentist there. who's giving away toothbrushes and toothpaste and talking about his office and his practice. None of these people have charge us to be there. They're trying to, gain business in the community and be a good partner. So we try to utilize as much as we can people that will come out. The insurance company provided us a licensed nutritionalist who, with an appointment, the employees could meet with her for a 30-minute session. That was the biggest hit that we've had in quite a while. They just loved that. Actually going over their diet and how they could improve their food, healthy ideas and recipes for them and their family. And the word spread quickly, and all the sessions got booked up really fast. But I just want people to think that you can start this without a lot of money and then grow into whatever you think is best for your employees and the employee morale, because it really is, from 6 years ago, a complete culture change here where people are excited about the WAVE team and the things that are happening and when's the next health fair and what's going to be there. We had this year for the first time a veggie food truck that parked outside, and they were there serving vegetable lunches for people when they would leave. They could pick up a lunch and take it back to their work site. We've already this year booked at no cost. These are the type of things that you can do that really are not expensive. With the American Cancer Association, we've already booked for October. We have a breast cancer awareness workshop. Our workforce is 80% female here. So in the last event that we had at one location, we had 300 employees that attended, and we had a mobile, it's called the Mammo Van, to do mobile breast exams, and they were parked outside. They were from Boca Raton Hospital. We gave away to everyone that attended magnets for their car, the breast cancer awareness magnets or keychains, things of that nature. And we had a speaker. The first year, we didn't have all these things. This is our third year of doing this. Well, this will be our fourth. But the first year, all we had was an employee who got up and told her story, who was a breast cancer survivor. And it was extremely emotional, and a lot of the employees knew her and respected her, and she got a standing ovation. And but these are the type of things that you can implement without a lot of cost. Was the whole purpose of this.
Well, and I think to summarize what Bob just said, if you don't ask, you're not going to get. You really do just need to ask. Don't be afraid to ask. It does help Henderson that Sightland Marsh & McLennan, their wellness and benefits consultant, has a lot of partnerships in our state and across the United States that we can tap into, and we can bring them these low or no-cost programs. One thing I did want to touch on that Bob mentioned was the claims. On the claims is, the first year or two, you might even see a spike in your claims, which I believe happened here at Henderson.
Yeah.
And don't let that scare you. What usually happens is you start rolling out programs, and it increases awareness of things you may not have known that are wrong with you. And it drives people to the doctor, which is good. So your RX claims might go up, your preventive claims might go up. So we need to, just make sure that companies realize that claims might increase a bit in the first or second year, and then they start to stabilize. It does take 3 to 5 years to start recognizing the ROI in a wellness program. The next slide just shows a sample budget. Your budget can look just like this. You can take it right off this slide, or you can just start one on your own. Just making sure that you prioritize which interventions will make the biggest impact on your health status. And keeping in mind again that your program costs are gonna vary greatly depending on the size of your group, how complex the services that you want to input or have in your worksite wellness program. So as we go on, and kind of just as an overview of success factors for wellness programming. Again, as all of us had mentioned, senior management and C-suite participation and support is key. Catching people doing something well, showcase their success. When we've had significant weight losses here in Henderson, or people have quit smoking and have stayed smoke-free, we've made sure to recognize those people to motivate others. Leveraging your worksite health champions to promote your program. We could not make this happen without our wellness team, the WAVE team here at Henderson, or the SWAT team at Sightland, Marsh & McLennan. Sightland, Marsh & McLennan comes into Henderson and just facilitates the meetings, but it really is the team that makes all of this successful. The committee has been they're the ones that are creative and innovative. After a while, your program, especially after 6 years, can get stale, but having a nice mix of employees on your committee will keep it fresh and fun and give you some new and creative ideas. And again, as we've been saying probably for the last half hour, don't reinvent the wheel. Really utilize those resources that you have, either through your carrier, through employees at your own work site, friends outside of the workplace, any local hospitals and things like that can really make your program a success.
We've had cholesterol, the good, the bad, and the ugly. We've had office yoga. We've had the amazing race. We've had Chug-a-Jug, which was to increase water consumption. We purchased the water bottles from a company and had the WAVE logo put on there. And everyone at work was walking around with their water bottles and talking about it. We've had the fruit and veggie challenge this past year, where employees were encouraged, given healthy recipes, encouraged to eat more fruits and vegetables, keep track of it, and then at the end of it, the teams were, received prizes for who had changed the most, who had eaten the most vegetables, made the change in drinking the most water. We've had, very similar programs, except the team or employee approach, from the biggest winner to the biggest loser for a weight loss program. Then we had another one that we named Waste Management, and we've implemented them with a lot of success right at the first of the year, where people, typically put on some weight over the holidays, and then it's a resolution, and we're ready to get started. And we've had a lot of success with those programs at those times. Also, the smoking cessation programs, we ran 2 of those. The first time, 7 employees remained smoke-free. They kind of met like I guess it would be like a 12-step group or support group, where they were helping each other to stop smoking and discussing their problems that they were going through with a facilitator. And the last one, we had 2 employees that successfully have quit smoking, and then we follow up, and if they're still smoke-free in 6 months, they get an additional incentive. If they sign up for the program and complete 90 days, then they get a cash incentive. At the end of 6 months, if they sign an attestation saying that they're still smoke-free and that they are not smoking, then they get a larger cash incentive. So, doing things that the employees feel you're not only doing it for their health, but they're also getting something out of it. The savings on the health insurance of $520 a year, the getting paid for quitting smoking and all the money that you can save without buying the cigarettes, or the come in for a free lunch and have the webinar and things. All those things employees have told us in surveys that they value, because it really shows that the company is willing to go the extra mile and do something extra for them that's really not expected. It's not just show up for work and then go home at the end of the day. They feel that the company did something because they cared about me today, and I learned something and got something out of it.
So you're probably saying all of these no or low-cost resources that they've been talking about, what are they? Well, on the next slide, we list out some of those, and I know Jessica will have some ideas to add in also. But, of course, the CDC, especially the CDC, since they're putting the webinar on today, visiting their workplace National Healthy Worksite website to find out some of the options that are available to you. Any of your local wellness councils or coalitions can also help. Again, I like to throw in there, utilize your carrier. They do have some free or no-cost or low-cost options for you. Local hospitals and colleges, as Bob said, we contacted one of the colleges to have free on-site chair massages. So they're always willing to help. Again, Bob mentioned the American Cancer Society, and then we've reached out to the American Heart Association in the past to give some lunch and learns. Your local health and fitness clubs will sometimes give great discounts to employees if you come in at a group rate. And again, don't forget about your coworkers. Here at Henderson, we had a lady that was a Zumba instructor. So instead of going outside and hiring somebody from the outside, she went ahead and taught classes here for the employees, and she was low to no cost. So that really did help. Bob, do you have anything to add?
Just at one of the health fairs, try to be creative and utilize resources that you have in your community. We had one of the WAVE team members contacted a local smoothie store and said, we're having a health fair. We have 600 employees that will be there. We would like to ask you if you would come in, make smoothies for free, give them like a 4-ounce sample of your product, maybe offer them a coupon, and they'll know where you are, and it may increase your business. It may not. We gave no guarantees, but, things like that, people are very receptive to. We just got, for one of the raffle gifts of the health fair that we had last week, our special events coordinator contacted the Florida Marlins. They gave us 4 club seats, magnets, all kinds of sports things for giveaways. And, I would just say be creative, try to think outside the box. We probably get a lot of buy-in from the community because we're a community-based mental health center that's a not-for-profit. So I'm sure for a for-profit company, it's going to be a little more difficult to get those kind of things for free. But, just think outside of the box, read as much as you can. I really think that having a consultant like we have with Kirsty makes the difference because they deal with a wide range of companies. There's some that do things that we would love to do but don't have the money to do. But then we try to think, how could we do something like that for less money or maybe scale back one aspect of it? So it's really important to always be breathing new life into the program and new ideas and keep it innovative and motivating for the employees.
So Bob and I would like to hand it back over to Jessica to talk about some other low-cost resources and start wrapping up today's presentation.
Thank you, Bob and Kirsty. You guys gave some wonderful ideas as far as low-cost resources. As far as the local county, state public health departments, I can't stress enough to tap into those guys. We're a regional health district. We have a variety of different programs that we run. Radon kits, FOBT kits as far as for colorectal screening cancer, all of those types of things at any given time through grants and different funding that we have to support those things. And we like to take that on at Worksite to promote those types of things. County extension offices are wonderful. They very science-based, evidence-based. They have different programming at any time, newsletters, a variety of backgrounds, registered dietitians. Your local wellness council, of course, that's something that I would promote very heavily. I'm with the wellness council, of course. But that local key person for technical support is so very key, just like what Bob was saying with Kirsty, to continue to provide ideas. We see a variety of businesses, and we can help make those connections as far as what others have done to give ideas and connect others. So great resource there. Local hospitals, wonderful resource, variety of backgrounds. And colleges. We have a new actual Worksite Wellness class that's going on in our area, and they are working with some of the businesses around their community, and they really do give kind of a fresh perspective. They see some different things, so it's been nice to see that to come up. So that's just some examples to tap into with that for low-cost resources. So just in summary, be sure you want your to let your data drive the health improvement planning process. You can't stress that enough. It is an evidence-based process, and you just need, it's like a recipe. You just follow the recipe, and hopefully, you do A, B, C, and then you get to D. That's really what we're doing with this. So let your data drive that. Multiple interventions, are most effective. Just like we talked about with that tobacco example that I gave, multiple level strategies that hit on many areas. So you want to hit on programs, policies, environmental supports, and health plan design, and then of course at a variety of levels. That's individual, interpersonal, organizational, and then the health, environmental, excuse me. You also want to balance those employee interests and health and safety priorities. This will help you set that program up for success by that delicate balance between those interests and priorities. And then, of course, link your plan to your business objectives and then tie it back to employee performance. Great way as far as to, again, maintain success for your program. So with that, I will turn it over to Toy.
Thank you, Jessica. And I want to thank all of our speakers today. We have had some great information from all of you, so we were so excited to have such a diverse group to deliver this information and give such great ideas to you all, our attendees. This is the contact information for all of our panelists today. There have been some questions that have come up that are questions directly for the panelists. I did try to answer some of the questions that came up, but some of them are strictly for the panelists, and I will try to get to some of those questions before we close today. But if you have a question for them directly, these are their emails, and you can email them to ask your questions. These are two websites that we use for the National Healthy Worksite program. The one on the left is the Workplace Health Promotion webpage. That's cdc.gov/workplace health promotion. You can find some great resources about implementing a worksite health promotion program on that website. There are several tools that you can use, several resources, so I advise you to take a look at it and get some good information from there. Also, the one on the right side of the page is the National Healthy Worksite program website that has program updates and links on there. The slides for today, if you are interested, are there under program news. So if you go to the home page, in this area over here is where you'll find the program news. So the slides are there for today. We also have community partnership issue brief for the community partnership webinar that was delivered in February. That issue brief is online now under program news if you would like to take a look at it. We also have our newsletters on there, so if you want to look at those, and other tools that you can go to are there as well. The webinars, if you would like to view the previous training webinars, they are under webinar archives, so you can take a look at those too. The email address for the program is also on this page toward the upper right-hand corner. Again, if you have questions, you can email us. If you can't contact the panelists for some reason, you are welcome to email us directly at nationalhealthywork@cdc.gov. We do have an upcoming event, which is the incentives webinar. You've heard a lot today about incentives, and I've actually gotten a couple of questions about incentives. So if you are interested in learning more about incentives, we will have that webinar May 20th from 1 to 2:30, and we will have David Anderson and Sharon Colbert will be our featured speakers for that webinar, so we are really excited about that one. And then the final Worksite Health 101 training webinar will be held July 15th. That one is going to be program evaluation, and we'll have Lori Clough and James Hershey from RTI International. They will be our featured speakers for those. So these are the registration links for those if you would like to go online and register for those as well. I also want to thank our key partners for the National Healthy Worksite program for their great work and their support. Viridian Health Management and RTI. They are our implementation and evaluation contractors. They have been wonderful in helping us with these training webinars and the National Healthy Worksite program. So I want to thank them and recognize them for their help and their support. As I mentioned earlier, we do have continuing education credits. 0.2 CEUs are available, and 1.5 CHES credits are available as well. So you can go to www.cdc.gov/TCE online, and you can register if you have not used that system before. You can register as a new user and log in and find program implementation, Worksite Health program implementation as the title for today, and redeem your credits if you are interested. So as I mentioned, we do have a couple of questions that I wanted to get to. Let's see, for Bob and Kirsty, the question came up of how do you track points for your program?
Well, as we mentioned earlier, Sightland, Marsh & McLennan invested in an online wellness portal, but prior to that, we were actually manually doing them. It was sort of a headache, but between Henderson and Sightland, Marsh & McLennan, we were able to make it work. I mean, we had a simple Excel spreadsheet, and it was implemented through there. With our online wellness portal that we are rolling out to Henderson on 6/1, that is going to make all of our lives a lot easier, and you'll be able to track yourself. You'll be able to see where you stand in your points instead of the employees individually calling Bob or Candace or Allison and asking, well, how many points do I have and how many points do I need? Bob, do you have anything else to say to that?
No, it was pretty cumbersome here this year because we did track it. And tons of receipts were coming in or notices from doctors coming in, especially now that we're getting down to the wire of the deadline for the points, May 30th. The calls are escalating. So the fact that next year we're able to turn it over to the employees so that they can track it themselves, enter the things that they do themselves, and all we'll have to do is go in as an overview to see how many points they have at the end of the year is a big plus. But that's what we've done. This is the first year that we have tracked points, and that was pretty time-consuming. But the next year, when they're in charge of that themselves, it'll be a lot better.
And Troy, just to add to that, all we will have to do from a Henderson or Sightland, Marsh & McLennan side is just approve them administratively. So we won't have to track them. We'll just have to approve all of them.
All right, thank you. Another question for all of the panelists. Do you have any suggestions on how to get the county HR involved in working towards worksite wellness when there's been some resistance?
Do they mean from an organizational standpoint? Is that?
Yes.
Okay. Jessica, do you want to take that one since you're more on that side?
I guess my thought was obviously demonstrating any return on investment values that you could communicate with them, talking about resources locally that could help them make that happen. Those were just some of the things off the top of my head. And of course, I think the dollar value, always relating it back to that hits home with most leaders.
Well, and to add to that, Jessica, as a consultant, trying to sell wellness is not going to work. Either people get it or they don't. And what I usually tell any prospects is, you know what, I'm here just to educate you on wellness. If you don't get it, I'm not trying to sell you to get it. At some point, you are going to have to get it. And when you do, I guess you'll call me then. But just knowing that healthcare reform and the government are pushing companies towards this and allowing for, the differences in incentives and things like that, I think that's just a testament to we really do need to make our employees more accountable for their choices.
All right. Do you guys have any suggestions on how to engage workers that are remote or virtual?
I can take that, and I will tell you that this is Kirsty from Sightland. That is one of the biggest reasons why we decided as an organization to source vendors for an online portal. We do like the local personal touch that we can provide our clients, but we did find that we were starting to obtain more clients that were either remote or national. We have clients all over the country, and we can't be there. We can't duplicate ourselves or my team. So we said, you know what, we need something that we're going to have to put in place that is going to engage and incent participation from the employees. And it has really been successful. It still keeps that individual touch, but we can't always be there. Another way that we're able to do, we do a lot of webinars, not just for Henderson, but other clients. We've done video conferencing. We've done Skype. We've done anything that the employee or the employer will allow us to do to be able to engage those employees.
And we're looking at next year attempting to have the webinars and the lunch and learn sessions that we have to be online. So if it's an employee who works a midnight shift at a residential facility and they say, okay, I'm taking my lunch hour now, they could go to a computer and log in, and excluding the interactive piece of it, like you're having now with the questions and answers, would be able to experience the same educational information that was given out to the people that attended the seminar. And then we always invite them, if they have follow-up questions, just like you did, that that they can direct them to the person that was there, the panelist or the presenter.
And we've also seen where some companies will put the recorded webinar link out on their intranet to be able to access later, as Bob had indicated. Our portal is also going to allow for a place to keep those recorded webinars, and we can do polls and surveys right from that portal to see if Bob sat through the webinar and can answer a couple of the questions after the webinar is complete.
Okay. Another one is, how do you reward or motivate employees who do not participate in health insurance?
Great question. This is Kirsty again. We do take, as a wellness consultant, we do take a total population health management approach. So we do not care if somebody is on the plan or not. That's what is so nice about the beauty of the point system that Henderson is implementing. Although you can earn points, maybe those points aren't going just for the premium incentive. So we've seen where, yes, you have to get a certain number of points to be able to get the premium incentive, but if you're a non-member of the plan and you achieve those points, we'll put your name into a drawing at the end of the year for an iPad or for a PTO day or for something to reward that employee. And, we hope at the end of the day that employees are doing this not just for the premium incentive, that they're really just doing this for their own health. That's the utopia that we'd like to get to. That may not be across the board right now, but that's how we've been able to engage non-plan members.
Okay. Here's another question about unions. It says, are any of the example work sites mentioned today union sites? Do you have any consideration for those?
No, none of our work sites are unionized at Henderson.
And I have no clients currently on my list that are unions.
And this is Jessica. The examples I cited were not as well.
Okay. Jessica, someone asked while you were speaking if you had any experience with weight management programs that have been implemented. Did you know of any programs that were implemented that you could give examples for about weight management?
The one that we have, as far as at this point, that I have the most experience with is the National Diabetes Prevention Program. It's not specifically framed as much with a weight management program. It's more that they want to see those proactive measures of being physically active for 150 plus minutes and then nutrition. That's more of what I have seen. I have not seen much others, but that's specifically.
Toy, if they're speaking from just company weight management programs, other than the ones that we've implemented here at Henderson, and I believe Bob did a very good job of giving you a high-level summary of those. For the most part, when we as the consultants assist our clients in rolling out any sort of, whether it's a weight management program or contest, It's not about pounds, it's about percentage loss. Some companies like to take a team approach versus an individual approach to kind of get the buddy system going. I've seen some companies reimburse for attending Weight Watchers or enrolling in Weight Watchers. We've had at Henderson here, we've had the nutritionist come on site, which has helped with weight management, and they're getting 20 to 30 minutes of personalized time with the nutritionist. With our online portal, we will be able to help Henderson this year with coaching because there is a tracking of nutrition and exercise piece of the portal. So if our nutritionist should come in, Bob, as the employee, can grant our nutritionist access to their exercise and nutrition logs so that they can talk through what are they doing right, what are they doing wrong, what needs to be changed to achieve their goals. So those are just some of the successes that we have seen.
And the weight loss programs we've had, we ran them both ways, individual and teams. But on each one of those contests, those are the only ones that we have charged the employees, where the employee paid $10 when they signed up, and then Henderson matched that money. We've had from 35 to 45 employees. So when they all signed up and then Henderson matched the money, there was between $700 to $900, depending on which contest we did, that was, in the end, divvied up top male by percentage, top female by percentage of body weight, second place in those categories. We have the team approach. And the webinars and those things are attended by everyone. Not just about 400 of our out of 600 employees here are on the health plan. So really only 2/3 of the staff do it for the incentive for the healthy motivator rate, and everyone here just enjoys being part of the culture really that's changed here, and a lot of camaraderie and team building and things going on around these contests.
Okay, and one more question. Do you have any suggestions for policies for employers to attend wellness activities or do physical activity during work hours?
For those, as far as for the physical activity during work hours, I have seen, the 15-minute breaks for physical activity. I've seen the flex time where they come in a certain time, they can get off. I've even seen some where if they use like a lunch hour or afternoon time to work out, then they can have like an extended lunch hour, for that. And what was the other policies they asked about?
Wellness activities.
Wellness activities. And then again, just with the on-the-clock time for prevention programs, like chronic disease prevention programs, I've seen those as well, which have been well received because then employees don't have to be obviously off the clock for that.
Yeah, we allow employees to attend the events that we have on the clock. We've had anything that's physically strenuous on them, we've recommended that they see their doctor, that they not participate without, their doctor's advice that they're healthy enough. But really, that has not been a hindrance here at all in implementing any of the programs that we've had so far.
And just to add to that, I think once companies move to an incentive-based wellness program, I think it's kind of something that does come hand in hand. If we're incenting you and want you to be part of this program, we're going to give you the time to do that. I have seen other clients who aren't to that point yet and say, you know what, you're going to have to do it on your own time. So I think that's a major difference.
Okay, we are out of time. Again, I want to thank our panelists for all of their experience, all of their expertise, and their great answers to our questions. If you would like to register for any of the upcoming webinars or have any questions, you can go to the cdc.gov/NHWP. You can email us, or you can register for any programs that we have upcoming on there. any webinars that we have upcoming on there. Again, I want to thank everyone for their attendance, and I will talk to you soon.